And we are doing California Assembly Bill 1360. Opioids are commonly used as medication as they help relax the body. Such medications include Oxycontin, Vicodin, codeine. When used correctly, opioids can relieve pain, but they can also create significant euphoria or high, which can later on lead to dependence and possibly addiction. Fentanyl, an opioid, is 50 to 100 more times potent, which is commonly used for enhancing heroin, cocaine, and methamphetamine, and etc. Overdose deaths often occur by a person mistakenly getting and utilizing fentanyl despite assuming they are buying heroin or prescription drugs. During the COVID-19 pandemic, the opioid crisis resulted in a significant increase in alcohol and substance abuse. Over 560,000 people in the United States have died from an overdosing involving opioids since the epidemic began, which is 8 times higher compared to 1999, which the epidemic began. In the state of California, opioids deaths have increased 121% between 2019 and 2021 due to fentanyl being mixed in. 10% of people identify as having a substance addiction disorder are receiving treatment. From 2020 to 2023, emergency departments visits for any drug overdose and opioids overdose increased by 12 to 34% significantly. In 2022, over 65% of inmates have substance abuse conditions who are serving time for drug possession or other drug involvement crimes. The first image is a California map. The map shown is a 2013 Narcan distribution project that is aimed to reduce opioid overdose by providing free Narcan and Atenone. The county with the highest rate of opioid deaths get more units of Narcan. More than 50,000 overdoses reversals have been done within 900,000 units of Narcan in 58 counties in 2018 to 2021. In the second graph, the graph only addresses the 2020 when the pandemic lockdown started. As we can see, the numbers of deaths related to synthetic opioid abuse is rising. The spike could be linked to stress, social isolation, and the use of substance use alone. Additionally, the lockdown made it challenging for people to receive in-person treatment for existing substance abuse problems and harm reduction services and emergency visits.
Policy solution: the California AB 1360 is the Hope California Secured Residential Treatment Pilot Program. It was introduced by the California House of Assembly and passed on October 10, 2023 on the state level. It offers defendants involved in crimes with illegal drugs voluntary participation in the pilot program, an alternative that helps defer the prosecution and avoid jail. In the counties of Sacramento and Yolo, it addresses the issue of individuals suffering from substance use disorders by providing them with facilities with residential treatment and various resources for support, including giving each resident their own treatment plan and access to counseling. It offers long-term support, taking away barriers, preventing individuals from receiving treatment, and help with their addiction with constant monitoring from trained professionals. Cost is covered under the Medi-Cal program and state funds for low-income individuals, and AB 1360 is a standalone policy in California with its main goal to provide individuals with a clinical setting who are suffering from substance abuse with the necessary treatment and support. The length of the program depends on a judge assessing the information provided by a biopsychosocial examination given to the participants and the evaluation from a healthcare provider, overall increasing drug treatment programs.
SB 43 Behavioral Health was signed by Governor Newsom in 2023 and remains in effect in most counties in California. It changes the criteria for which persons are considered to be gravely disabled to include those who are dealing with substance abuse issues. People who are considered gravely disabled can be put in involuntary holds in the state of California, which is why this specific bill is important. This bill would allow the state to hold those who are dealing with housing and food insecurities, among some other insecurities, as a result of their addiction. It sparked controversy due to ethical concerns and its possible infringements on personal rights and freedoms, supposed by many human rights advocacy groups such as the Human Rights Watch, which urged the state's assembly to reconsider its implementation. Additionally, it garnered a lot of attention of popular news outlets, and several news articles were published to describe the bills and its possible implications. For example, it was featured on the Los Angeles Times and the San Diego Union Tribune. At the same time, it was supported by the National Alliance on Mental Illness, or also known as NAMI, which is one of the more well-known mental health advocacy groups. S756, or the First Step Act of 2018, was signed into law in 2018 by the president at the time, which was Donald Trump. It was implemented at the national level. The main goal was to reduce mass incarceration through various means, including incentivization and law reform. So it modified minimum drug sentencing laws to make them shorter. It promoted good behavior by allowing prisoners to earn credits that would shorten their time in prison. And it implemented programs with purposes to keep prisoners out of the system after their release. So it also received bipartisan support, which means it was supported by the Democratic and Republican Party. It also garnered support from well-known prison and prisoner advocacy groups such as the Sentencing Project and the American Civil Liberties Union, which praised its humanity. Additionally, this act received a lot of coverage from popular news networks and had several articles published describing the acts and its implications. The act was covered in news sources including Fox News and NBC.
When evaluating the steps that could be taken to exercise AB 1360, here are some considerations. For inputs of our logic model, we found it necessary to have funding to support the staff who will help us raise awareness, and technology in order to raise awareness through media. Our first activity focuses on increasing awareness about drug treatment programs throughout local communities in Sacramento and Yolo County. The output of this activity would be increasing options for drug treatment programs. A short-term outcome would be providing individuals with choices amongst various drug treatment programs to choose what fits best into their lifestyle. Intermediate outcomes include increasing commitment to the drug treatment programs and higher likeliness of treatment completion amongst abusers. In long terms, the impact of this activity would lead to extended spans of sobriety amongst substance abusers. As for our second activity, of building more rehabilitation centers, inputs we'd require include staffing to facilitate and run the rehabilitation center and land space in order to build the rehabilitation centers. Outputs of this activity would include increased access to rehabilitation centers for those that are seeking treatment. A short-term outcome would include the centers having the ability to accept more admissions as they'd allocate the space necessary. Intermediate outcomes consist of increased acceptance of substance abusers into inpatient rehabilitation centers for a full span for full recovery. The long-term impacts of this activity lead to decreased prevalence of drug abuse.
We asked for short-term outcomes. Did California AB 1360 help offenders obtain information on what and which substance treatment facilities are available with the ability to comply with their needs? For question 2, immediate, intermediate outcomes. Did California AB 1360 have an impact on increasing in acceptance in inpatient rehabilitation institutes for complete rehabilitation for offenders? Lastly, for question 3, long-term outcomes. Did California AB 1360 reduce the prevalence of substance abuse among offenders with prolonged periods of sobriety?
We identified our policy as a long-term impact with a quasi-experimental time series design evaluation. Time series design was chosen due to the lack of adequate comparison groups availability. The policy will be focusing on individuals in Sacramento as well as Yolo County, including statues of nonviolent drug offenders receiving treatments for decreasing substance abuse and crime prevention. Data required would be rates of first and second time nonviolent drug possession offenders alongside rates of substance abuse and crime rates in Sacramento and Yolo County. The DHS, Department of Health Services, includes data reports for drug possession offenders and crime rates in each county. This would allow us to access data on Sacramento and Yolo County for comparison purposes. Substance abuse rates can be accessed through the CPDH, California Public Health Department, yearly brief review. These data sources are required to be reported to the state each year, and therefore they are kept up to date and well documented. Access to historical data will come from each past year's county health reports, which can be found online. We will be comparing rates of drug possession offenses and incidents of crime rates in Sacramento and Yolo County from October 2018 to October 2028 to distinguish differences in substance abuse and treated individuals. As for the new data, the reports will be collected and analyzed each year until 2028.
There's a lack of appropriate measures needed to assess prolonged periods of being drug-free for each individual. Due to the pilot program being different lengths for everyone, it is very difficult to monitor whether or not the program reduced the prevalence of substance abuse. It's difficult to obtain data for relapse, continued use of counseling, and length of being drug-free. Finding a comparison group similar to the Hope California may not be accessible or be equivalent enough for data comparison. Those who voluntarily participated may be more inclined to adjust their behavior compared to those who accepted this program only to avoid jail and not want to work on their problems of substance abuse, skewing and affecting the program's desired outcomes. This program, based in Sacramento and Yolo, has different environments, cultures, and drug patterns, making it difficult to compare to other programs. And economic conditions such as Medi-Cal no longer covering the treatment and costs for facilities for low-income individuals due to a change in laws can create a financial barrier for individuals who may need the support and treatment but can no longer afford it.
Possible impacts on health equity for Assembly Bill 1360 include: firstly, decreasing health disparities, as it would increase access to drug treatment programs for those who are struggling with substance abuse disorders. Second, the policy could decrease health disparities by decreasing mortality rates of those suffering from substance abuse disorders through getting them the adequate care they need, leading to recovery. Lastly, the policy could also decrease health disparities by decreasing crime and violence rates in the community, as individuals suffering substance abuse disorders are being taken off the streets and receiving the proper care they need to gain back a healthy mindset.
California Assembly Bill 1360's Hope pilot program launches a treatment program and support for persons who have been convicted of drug-related crimes and who also deal with substance use issues. In your opinion, are there any other vulnerable populations that should be prioritized and included in Hope's pilot program?
Thank you very much for listening to our presentation.